Nobody announced it. There was no headline, "Workers lose pension security." No news report, "Employer health coverage eliminated." It happened gradually in the fine print of plan changes, from full-time to part-time to contractors. The benefits erosion was one of the largest income transfers in the last 50 years, and most people didn't notice until they needed what was no longer there. Start with pensions, the largest single benefit loss. In 1980, 38% of private sector workers had a defined benefit pension. By 2022, it was under 15%. Show defined benefit versus defined contribution coverage. 401k plans replaced pensions. Workers now bear all the investment risk. The 401k was meant to be a supplement, not a replacement. Employers saved on pension obligations, shifting risk to workers. Employer-provided health care followed a similar path. In 2000, the average employee contribution to health insurance was $1,500 per year. By 2023, it's over $6,500, plus rising deductibles and copays. Show healthcare cost share growth. The plan still exists, but workers' out-of-pocket costs have exploded. A $6,500 contribution plus a $5,000 deductible is close to having no insurance at all for a $60,000 family. Here's a mechanism most people have experienced but never named. The Affordable Care Act requires employers to offer healthcare to employees working 30-plus hours per week. After the ACA passed, part-time work at exactly 29 hours spiked. Show part-time employment data. Employers adjusted to stay below the benefit threshold, cutting income and benefits for workers. This happens with sick leave, overtime, and retirement contributions too. Let's put a number on what benefits erosion costs workers. In the 1980s, a full benefit job package was worth 30 to 40% of the base wage. A modern low-benefit job at the same wage is worth 30 to 40% less in total compensation. Show total compensation comparison. Wages didn't fall, but total compensation did. This hidden wage cut didn't show up in headlines, but it's a significant loss. In countries with public benefit systems, healthcare isn't tied to employment. Losing a job doesn't mean losing medical coverage. Retirement security isn't dependent on market performance. Parental leave exists regardless of employer generosity. Show US versus Germany, France, Denmark. The US spends more on healthcare, but less efficiently. The difference is where the costs fall. In the US, risks are concentrated on the worker. Benefits erosion is a wage cut without the name. It shifted risk and cost to workers while employers captured the savings. Next, why schedules became unstable and why that's as damaging as low wages. Subscribe.